Good morning, everyone. This is a meeting of the Baltimore City Council Health, Environment, and Technology Committee. This committee is now called to order. I am Danielle McCray, chair of the committee and councilwoman representing the 2nd District. In attendance today, we have Councilman John Bullock. We have Councilman Mark Conway at this time who are committee members. I want the record to reflect that Councilman Ron Dorsey, Councilman Felicia Porter, Councilman James Torrance, and Councilman Yitzi Schleifer are not in attendance at this time. Also joining us are council members Christopher Burnett, representing the 8th District. Also in attendance, we have Matthew Peters, staff to the committee. We have Nina Thimelis from the mayor's office, and we have Nikki Thompson from the council president's office. So I want to thank everybody for joining us. Before we get started, I just have a couple of ground rules. I'm just going to ask everyone to stay muted until you are recognized by the chair. Also that you just mute yourself when you are not speaking. Before you speak, please identify yourself, the agency or organization that you are with, and your position. Please speak slowly and clearly. After you have finished speaking, please mute yourself again until you are recognized by the chair. I'm also asking that any committee members and city agency officials, please keep your videos on for the duration of the hearing unless there are technical difficulties preventing you from doing so. This is for transparency, so members of the public know that we are listening and that we are paying attention. Last, for members of the public, there will be an opportunity for public testimony later today. You will have 2 minutes each for your testimony. Today, the Health Committee, the Health, Environment, and Technology Committee is hearing 3 pieces of legislation today. We are going to start with a work session on Resolution 21-003R, informational hearing, Baltimore's COVID-19 vaccination plan. Then we will move on to a hearing on Bill 21-0075, study and report, sewage backup, expedited reimbursement, and direct assistance program. And finally, we will hear Resolution 21-0039R, violence against women and overlooked public health crisis. We're now going to start with Resolution 21-0003R. It's for the purpose of inviting representatives from the Baltimore City Health Department, Baltimore's healthcare community, and other interested parties before the Baltimore City Council to discuss Baltimore's COVID-19 vaccination plan. The committee originally held a hearing on this resolution on January the 27th of this year, 2021. And today we're going to have an update from our health department on their progress of vaccinating Baltimore City residents, and then give committee members an opportunity to ask any questions. At this time, we're going to move straight into the Baltimore City Health Department. We have, looks like Commissioner Deraza, and she's going to be sharing a presentation at this time.
Great, thanks, Chair McCray. I am going to switch modes here so that you guys can see it. Are we good to go? Can everyone see my screen? I will assume silence is a yes. Good morning, everybody. My name is Deraza, and I am the Health Commissioner for Baltimore City. I am excited today to present some updates since our last council hearing, speaking about our vaccination efforts. I will start with our general disclaimer slide. So information presented today, especially our information around data, is accurate as of today. So this is subject to change. We do update our data regularly. So this is, again, subject to change from day to day. I will be providing some general information on the COVID-19 vaccines, including background on those vaccines, vaccine side effects, and where the public can access vaccine. I'll also provide an overview of our general vaccination campaign. I'll review our vaccination benchmark goals, our pediatric vaccination plans and any updates, as well as our shifting vaccination strategy, as we've seen demand for the vaccine shift as well. This will include covering some of the tools that we're providing in our neighborhood canvassing toolkit and how we're supporting our partners through microgrants. So as a refresher, there were 3 vaccines that have been granted emergency use authorization by the FDA for use in the general population. We have our Pfizer and Moderna vaccines, and both of these are what we call mRNA vaccines. Our Pfizer vaccine does require that the 2 doses be administered at least 3 weeks apart, whereas our Moderna vaccine requires that 2 doses be administered at least 28 days apart. Our Pfizer vaccine of note is currently the only vaccine approved in the US for individuals over the age of 12. So really getting down into our pediatric, specifically our adolescent population. Both vaccines are highly effective and are effective against the variants when you receive 2 doses. They both reduce the risk of severe disease in individuals as a result of getting COVID. Similarly, we have our Johnson & Johnson vaccine. This is what we call a viral vector vaccine, so slightly different technology used to produce it. It is a single dose vaccine, and it is approved for individuals 18 and up. It's also highly effective and effective against the variants and reduces the risk of severe disease and death. Our vaccines can have side effects. Many of them are just mild to moderate and last anywhere from about 1 to 3 days following the vaccine. Some people experience pain, redness, or swelling at the location of the vaccine in their arm. Some people also experience tiredness, headache, fatigue, muscle pain, joint pain, fever, and lymph node swelling. For individuals who receive Johnson & Johnson vaccine, nausea has also been noted. So where can residents in the city get a vaccine? There are multiple locations and multiple opportunities to access vaccines here in Baltimore City. Our local pharmacies are providing vaccines. We have federally qualified health centers and community health centers providing vaccines. Our hospital partners and those within the healthcare system are providing vaccines. And we are supporting what we're calling mobile response teams that are performing pop-up clinics throughout the city to provide vaccines. Additionally, we have some mass vaccination support in the downtown area. We currently publish our weekly calendar of vaccination events on our website. So if you're ever looking for a potential location to get a vaccine, you can find that information on our website at coronavirus.baltimorecity.gov. You can also schedule a vaccine via phone. If you don't have access to the internet, you can call 443-984-8650. Additionally, if you do have access to the internet, you can go to covax.baltimorecity.gov. We are offering free transportation to and from vaccination appointments, whether it's with one of our locations or through a community partner, and that is made available by calling 410-372-3444, or you can email covidtransport@mjminnovations.com. So switching gears to talk a little bit about our efforts to date. To date, we have held 463 clinics and provided over 44,000 total doses. And these clinics were held in conjunction with many of our partners. The map on the left here shows the location of those clinics that have included, again, BCHD, either BCHD administered vaccine or vaccines that were administered by our clinical partners with support from the health department. Not all clinics that have happened in the city are represented on this map. We know that there, again, are many partners who are providing clinics, and there's also additional street-based outreach. There's clinics that we've held in our homeless encampment sites, and those are not necessarily represented on this map. And in addition, multiple clinics might have occurred at a single location. We also know that some areas of our map don't necessarily show where there have been BCHD clinics there, but we know that many of our partners, when we look, are performing clinics in those particular locations. So since January, we've deployed really a two-pronged strategy to ensure equitable distribution of our vaccines. This is inclusive of our initial mass vaccination pods at Under Armour and then BCCC, and now more heavily focused on our mobile response teams that are bringing the vaccine to the community and prioritizing areas throughout the city with low vaccination coverage. Of note, additionally, our homebound vaccination work is also not represented on this map. To date, we've had over 400 individuals referred through our MAP hotline, through screening, to be listed as a homebound resident who needs vaccination support within their home. And to date, in partnership with the fire department, we vaccinated, actually about 20% of those individuals have already been vaccinated. So our team goes out currently about 3 times a week, and we're working with other clinical partners via Lutherville Pharmacy, as well as partner LifeBridge and Bicor Shalom to vaccinate those homebound residents. So now talking about our overarching strategic goals. So we have stated a goal of by February of 2022, equitably vaccinating at least 80% of all Baltimore City residents, so inclusive of the pediatric population as well as the adult population. We've also focused on how we can reduce vaccine hesitancy or deliberation among our city residents. And this includes a particular focus and much more targeted outreach to communities that we know have been disproportionately impacted by COVID-19. And we're doing this through the work of our value vaccine ambassadors, but really working to provide accurate and transparent health information so that residents can make an informed decision. And then goal number 3 was really having a robust data management monitoring and evaluation system. So our dashboard. And the importance of that is that we want to ensure that we're providing transparent and accurate reporting to the city and all of our partners. So I'm going to exit this just for a moment so that I can pull up our dashboard. I'm going to reshare and get to our dashboard. All right, I'm assuming everyone can see the dashboard okay? So this is our dashboard where we provide real-time data on what our current vaccination rates are throughout the city. So beginning down here, looking at Baltimore City residents, this provides the total number, so over 269,000 residents. Actually, let me flip back. So let's start with all ages first. So over 278,000 residents of all ages here in Baltimore City have received at least a first or single dose of the COVID-19 vaccine. That is inclusive of about 47%. So again, this is all ages, birth through the end of life that have received at least one vaccine. If you flip through, you can also look at who has been fully vaccinated. So that means having received at least one Johnson & Johnson vaccine or 2 doses of the Moderna or Pfizer. And that's a little over 40% of the population of all ages here in Baltimore City have received at least 2 doses or the one J&J. And then lastly, when we look at residents over the age of 18, so adult residents that have received the vaccine, almost 57% of all adult residents have received a first or a single dose of vaccine here in the city. I'd also like to take a moment just to highlight some of what we're seeing when we think about disparities with regards to race. So looking more closely at some of our disparities as it relates to race, we do see that about almost 35% of Black residents have received the vaccine, at least the first or single dose of the vaccine, compared to almost 55% of white residents having received a first or a single dose. Of note, while we are still tracking this disparity and we're very focused on ensuring equitable access to the African American community, we have seen this disparity decrease over time. So initially it was almost 4-fold difference, and we have seen this come down significantly over time. Next, I'd also just like to quickly point out the differences in ethnicity. So comparing our Latinx community to our non-Latinx community, we see that about 47%, almost 47% of our Latinx community have received a first or a single dose. And again, this is all ages, compared to almost 44% of our non-Latinx community. So again, I think this highlights much of the important work that our value ambassadors within the Latinx community are doing to really ensure that this group has access to the vaccine and has the information they need to make an educated decision on the vaccine. All right. So I will now shift back to the presentation. All right. So shifting back, so currently when we look at our general benchmarks, and these were goals that we set early on as we were developing our vaccination strategy. We had set an initial goal of at least 135 residents being vaccinated by April 30th. And we wanted to vaccinate 40% of the entire population by August 31st. Again, this is inclusive of children, with 60% of the population, inclusive of children, being vaccinated by November 30th, and 80% of the population being vaccinated by February 2022. When we look more closely at this initial goal of fully vaccinating 40% of the population, we see that overall we have surpassed this initial goal. When we look, we're a little bit over 3,000 of, again, the total population being fully vaccinated, which is a good thing. When we look more closely at some of our disparities, specifically the goal we had set for African Americans, about 70%. We're about 70% of the way there for that group, and almost 80% of the way there for the Latinx group. Additionally, when we look at the goals we had set for our older adults 60 and above, we have surpassed that goal as well, with over 78,000 older adults being fully vaccinated. So talking a bit about our approach to pediatric vaccination. Again, our approach to pediatric vaccination is slightly different. So we know that we want to partner with schools, and we have been partnering with schools throughout the process to hold vaccination events. So we've been holding vaccination events at 9 schools geographically. We recognize city schools as an extremely important partner in this work, as a trusted leader, as well as a trusted just community space. So they provide the space and the additional support to really work with this group and to work with parents. At our vaccination events, we are performing exit surveys. So really understanding parental attitudes towards vaccine, what's their motivation and what was their experience with vaccination. And this data helps to drive how we continue to approach pediatric vaccinations. We've also been working with city schools to integrate our COVAX campaign, our overall vaccine campaign, into back to school messaging and vaccination at our school health centers. We're also contracting with community partners. So our federally qualified health centers and pharmacies that have also supported vaccination for other populations to vaccinate this larger pediatric populations. Additionally, we're recruiting for vaccine peer ambassadors. So as we're getting more children vaccinated, similar to how we have our value vaccine ambassadors for other populations, having pediatric value vaccine ambassadors who can speak to their peers about the importance of vaccination, as well as discuss their experience and what side effects they may have had. We're holding pediatric focused listening sessions. So again, very similar to the work that we've done for our other value communities to understand how we should shift or change any messaging to make it more specific to this group. And again, we will be deploying those pediatric value ambassadors in the future. So to date, when we look at a first or single dose COVID-19 vaccine coverage for children by age, when we look just at the 12 to 17-year-old age group, a little over 36,000 of those individuals have been vaccinated, which accounts for about 23% of this population. We do see slightly higher rates in children that are older, only because Pfizer was approved for 16 and up when it was first released. So we anticipate that those individuals are vaccinated earlier on. So challenges and opportunities to reaching our overall goal of 80% vaccinated by February of next year. So we've seen demand for vaccine just slow down, and this has been a national trend. The vaccine is very widely available now, and still there are many who are unvaccinated. So we've really shifted our strategy to what we're calling more of a ground game. So as opposed to housing mass vaccination sites, how do we allocate resources directly to the community to really meet people where they are? So engage people at the level of where they live, where they work, where they play, and provide the vaccine as well as information there. We've been working with the Mayor's Office of Neighborhoods, who have been so instrumental in helping us canvass. So canvassing neighborhoods to provide information and perform outreach prior to any mobile vaccination events. Again, this is such a critical part of the work, really getting out there, speaking with the public, addressing concerns in a one-on-one conversation so that individuals can ask their questions of our value peer ambassadors or others that are supporting, and then be directed to a neighborhood vaccination site. So we have, as a result of this, developed a neighborhood canvassing toolkit. So this is the same information that our value ambassadors have, and there are materials and resources that have information on the vaccine. We have a self-guided training for individuals who are interested, and we've done this work in partnership with MICA, as well as the International Vaccine Access Center and Morgan State University, to ensure that it's culturally appropriate and that it addresses the concerns that we've really been hearing all along. And our purpose is really to empower residents to engage the community and get the word out about the COVID-19 vaccines. We realize that continued discussion on the vaccines is probably much more meaningful when coming from a fellow community member than it is when coming from the health department. So this is just an example of what is within our vaccine toolkit. So really how we can address some of the myths and concerns that are leading to hesitancy or vaccine deliberation. There's discussion on talking about the facts, what it is that we do know about the vaccine, discussing any misperceptions or rumors that individuals have heard about the vaccine, and then also providing access. So once we've answered questions, how do individuals book an appointment? How is it easy for them to access exactly what they need? And we do have links to these value materials that we can share. So we know, again, that this message goes far beyond just the health department, and that really it's the work of local community leaders, it's the work of our value ambassadors that will help to encourage residents who are still deliberating to get the vaccine. So again, neighborhood associations can access this toolkit, and they can organize canvassing events. Volunteers who are interested, again, in sharing this information can access this, as well as just general sharing on social media and listservs, so that individuals are seeing the information and know where to go if they have questions. Additionally, we're supporting community vaccination efforts through microgrants. So we've been able to partner with CivicWorks to provide additional financial support for community organizations that are doing this COVID-19 vaccine and education and outreach that's so important, and that are hosting the vaccine clinics. So if individuals present proposals on education and outreach, specifically in low vaccination coverages, that are focusing on our value community groups, we provide, they can apply for grants up to $5,000 to support their vaccination efforts. That is it.
Dr. Deraza, I want to thank you for your presentation. I also want to thank you and your entire team for your leadership on just making sure that we have equitable vaccination throughout our city. Committee members, we're going to move on to questions for the health department. So just signal or use the raise hand function if you have a question for the health department. I'm going to go ahead and start with my questions at this time. At our last meeting, it was shared that there were gender disparities in receiving the vaccine. It was stated that more women were getting the vaccine than men, and targeted efforts were being taken to target Black men due to disparities. Have we seen an increase in vaccinations in Black men, or do trends still show disparities at this time?
Good question. So I'll start, and then I also have Dr. McDowell, our Chief Medical Officer, on that could potentially talk about this. So I know I mentioned our value vaccine ambassadors a few times, and I realize I may not have talked about what those groups are and what they do specifically. But early on, we established what we call our value communities. So groups that we know that were disproportionately impacted or have been marginalized. This is inclusive of young men. This is inclusive of African Americans. This is inclusive of our Latinx population, pregnant or lactating individuals, and our pediatric population, just to name a few of those populations. So we do have a group that is focused on young men of color, and we have held a number of listening sessions. And this is an opportunity to even thank one of our partners, Hopkins, provided a number of young African American male doctors to speak with this group and to ask this group specifically what their deliberations were, what their hesitation were around getting the vaccine. and we got a lot of great information about how we can better engage this community. So to broadly answer your question, yes, we are still seeing those disparities between men and women, between African Americans. But I think, through our listening sessions, we've gained a lot of insight on how our messaging should be focused, as well as how our events should be focused. So, for example, one of the things that we heard was that individuals don't want us, us collectively, the health department, to come in and just leave once we're done, right? Like they're looking for sustained community engagement. And so what does that look like, right? Not just coming for a vaccination event, but what are some additional resources or supports that we should be providing at these mobile response vaccination events to support this community specifically? And Dr. McDowell, please, if there's anything else you'd like to add, feel free to chime in.
Thank you, Dr. Deraza. I think you hit on it in broad strokes. We are, just kind of reviewing the dashboard. This is the general population. We are seeing disparities, but specifically when we look at race and gender, we do see that disparity, especially for our young population. So young men, young women that are less than 40 years of age. So we are seeing that between the African American men and African American women. Noting that African American population in Baltimore City is the majority population. So that is there. As Dr. Deraza mentioned, the health department, through the work of our vaccine peer ambassadors, and really our town halls, and going out and figuring out and listening to young men, and just men in general, because it is about young men. That's where we're seeing like the greatest disparity and the lowest vaccine coverage, but we do see it across the board with older men. The vaccine coverage is lower. So bringing vaccine to where young Black men are, engaging in questions and information, canvassing as well as a big piece of it, building that trust, that ground game strategy, in building trust within the community is going to be important for our work in getting young Black men vaccinated and closing that gender gap that we're currently seeing.
Okay, thank you both. We just spoke about building trust within the community, and one of the primary outcomes that you guys stated back in January, you just went over it again, was that we were looking to get our population, the city's population, at 80% by February of 2022. Can you dig a little bit deep into how close we are there? What additional initiatives have we taken since that January meeting that you may not have touched on within your presentation? And what barriers are we facing to get everyone to that 80% goal by February of 2022?
Yeah, I'll start and then again probably kick it over to Dr. McDowell to speak more about this. So, much of that really hinges on the daily rates of vaccination, which we have seen slow since the end of May. Again, this is a national trend. And so now a lot of our work is focused on the efforts of the mobile response team. So I will say that's maybe one of the primary differences, I would say, from early January, was while we had mobile response teams, if you recall, they were very focused on beginning with our senior housing population. And that was the population that was eligible. Now that there's widespread eligibility, we've really shifted to have more mobile response teams focused on the broader population. At the same time, there was very high demand in January, right? And we're seeing that demand dwindle. And so now is much more of the hard work of that engagement, right? It's not that people aren't knocking and clamoring for the vaccine. We really have to go to people, and that means the rate of vaccination is going to be a lot slower than if you had 20 mass vaccination sites that were up and running. And so while 80% is still very much the goal, I think it will really be dependent on interest and how people, access the services that we're providing in our mobile response clinics. But still very, very much the goal, and very much will continue to do that in partnership with our community-based organizations and with healthcare systems. We talked a little bit about our pediatric vaccination work, for example. This is a key population where I think parents, I know parents are very trusting of their pediatricians. And so while the health department certainly has an important role in providing education and hosting events at our city schools, there are many parents who are going to want to go to their pediatrician. And, how do we advocate at the state level to ensure that pediatricians have access to the vaccine so that they can vaccinate within their own clinics? So I think all of those things will kind of influence how quickly we're able to get to that 80%, but 80% remains the overarching goal. I don't know if Dr. McDowell has anything to add.
Yeah, again, Dr. Deraza, I think you hit on it all. I did want to speak more to your point, Council Chair McCray, about trust building and what we're doing at the Health Department to build trust, to rebuild trust, to sustain trust in the vaccination efforts and in the health department. So this is something that we are thinking very deeply about and are putting in action. One, the emphasis on our vaccine peer ambassadors. So these are trusted messengers in the community. Also, the focus on amplifying messaging through trusted members in the community, through our mass media messaging that's focused on our young men, through more targeted messaging as well, and through our neighborhood canvassing. The other piece of it is the health department is working with other organizations to see how we can start having sustained conversations around trust building with a focus on our value communities. Dr. Deraza mentioned earlier about our Young Men Vaccine Peer Ambassador Group. So we have held listening sessions for young men. A number of those individuals on the call were young Black men that were highly engaged in these listening sessions. And what came out of the listening sessions was the need for that trust across the board within our healthcare system, within the public health system, within the community as well. And being responsive to that, an additional town hall was held to bring African American clinicians that are men to speak to young men about the vaccine, to speak to young men about questions that they have, or maybe some mistrust that they may have as well. So these are sustained ways that we are going to continue to engage the community beyond the pandemic. To really rebuild that trust and keep that in place, because that's how we're going to move from where we are right now, where there is ample vaccine supply and there's multiple avenues for people to get vaccinated through their pharmacies, their local doctors, their hospitals, the mobile response teams, etc. But it really is through that one-on-one interaction, through the canvassing, by seeing trusted members in your community out in the streets hitting the pavement, by keeping the communication open through these town halls, that we're slowly going to move people from the vaccine deliberation or to more so wanting more information about the vaccine and possibly getting vaccinated. So this is something that will take time, but a very important point that you bring up about our need to rebuild trust and continue to sustain trust within our vaccination work.
Okay, again, thank you both. I just want to highlight that Councilman James Torrance from the 7th District, who is a committee member, he has joined the hearing. Next up for questions is going to be Councilman John Bullock.
Yes, thank you, Madam Chair, and thank you, Dr. Deraza. I'm glad that you talked about the school-age population as well as the pediatric population, which obviously are connected. I know we're both parents, and one of the concerns I have is really as young people are going back into schools in the fall. And so we know that, I have an older son who's about to be 12, so he's right in that age range for the vaccine. But can you talk a little bit about what folks should be expecting for young kids under the age of 12, as some of the trials are going on, the availability, and what we kind of should expect for parents and students with the younger students who are coming into schools later on.
Yeah, I'll talk briefly and then turn it over to Dr. McDowell. So, as of right now, we know that Pfizer is performing clinical trials and Moderna are performing clinical trials in younger children under the age of 12. We've heard that Pfizer will potentially seek authorization for that younger under the age of 12 age group. By the end of the summer, early fall, and so that again would potentially be the avenue for that population to get vaccinated. Additionally, we hear that Moderna is seeking authorization for 12 and up. So they would kind of be where Pfizer is now, possibly as early as this month. And so we'll have an additional option for this age group. I think, likewise, we know that next age group down it's a different type of population. Both Dr. McDowell and I are pediatricians, where like 12 and up may be more influenced by their peers, though obviously parents play an important role in helping make the decision. But that 6 to 11-year-old age group it's probably much more parental influence when it comes to vaccination. So, I mean, I think one of the things that we've tried to do is really how do we provide education to the entire family, right? So even as a parent, when you're coming in to get vaccinated, maybe you haven't made the decision about your child just yet, but being able to have those conversations of, based on what we know about the clinical trials that have been performed in children to date, which have shown again very high effectiveness with the Pfizer vaccine. So having those conversations early and often, I would urge all parents, if you have a primary care provider for your child, engage your pediatrician as you're making the decision. Just like when you make decisions about other vaccinations or other treatments for your child, we provide our local healthcare providers with pretty regular updates. So as we're receiving them, we're sending out provider newsletters to our healthcare providers. The Maryland Department of Health is also sponsoring town halls and webinars for local pediatric providers to tune in so that they're up to date and informed. But certainly recognize the tough decisions that parents have to make for their children. And again, I think your pediatrician is always a good resource.
Thank you very much.
And we're going to move to Councilman Torres.
Thank you, Madam Chair. I just want to say thank you to the health department I just received communication yesterday about 3 mobile vaccination clinics in the 7th district this weekend. We're going to help you get that information out. I also have a question related to those parents like me who have small children who are 2 and above, and what type of PSAs or communications we'll have for those families, because navigating as the world opens up and person's not wearing masks, person's wearing masks, how should they navigate that world?
Yeah, that's a really great question, and certainly we're hearing it. So we as much as possible try to align with CDC guidance as well as state guidance, and there are a few things that we do know about the younger population. Very generally speaking, we know that they don't fall as ill as older adults, right? So there's maybe some decreased, decreased, I don't know that it's necessarily decreased virulence, but we just don't see where children become quite as ill as adults. It doesn't mean that children don't develop serious illness from COVID-19. So I would not say that, but certainly just being aware that they don't fall as ill. I think one of the things that has really happened is that many facilities have kind of taken upon themselves, especially in childcare, knowing how quickly things are transmitted, that they have continued to require masks, and I think that will be ongoing, right? That childcare facilities, that schools can make their own decisions around requirements for masks, regardless of what the city or state has in place, if they want to continue. I think as a parent, what I would do is I would be cognizant, right? Like that this is still something that is of risk to my child and to my family, even if I'm fully vaccinated, which I am. So I'd have my child potentially wear a mask if they're indoors in a crowded space around many other people. Outdoors, we no longer have the mask requirement in place. I would still urge caution for our unvaccinated population, obviously, again, if they're going to be in mixed company. But it is a tough decision and a tough balance to strike. I hear that.
Thank you.
Okay, and Dr. Deraza, I just have one final question on my end. Just one. What are we doing for outreach for our homeless population? Can you just speak to from January up until now, what strategies do we have in place or have we put in place for our homeless population, please?
Yes, absolutely. So I'll talk again very broadly, and then if Dr. McDowell has anything to add, she can chime in. So early on in January, our unstably housed residents were considered a high priority group because of their living in congregate settings. And so when we were also doing mobile response teams for our senior housing sites, we additionally had mobile response teams supporting our homeless encampment sites, as well as again congregate locations that support residents that are unstably housed. So we provided clinics even within the Lower Baltimore Hotel, where we have a number of individuals who are unstably housed who are there for the short term or the medium term. We provided vaccination events at those locations as well. And Dr. McDowell, did I leave anything out?
Yeah, so again, Dr. Deraza, I think, hit on everything. Just to give a little bit more context about where we are. Baltimore City prioritized individuals that are experiencing homelessness. Within our prioritization early on in the vaccination campaign, we decided that as a city that they were that community was a priority group. And started vaccinating immediately. So back in January, there have been 67 clinics held at congregate settings. And in addition to encampments, our team does go out and vaccinates in encampments throughout the city as well, to specifically make sure that individuals that are homeless and unsheltered also have access to the vaccine. Early on, we partnered with Healthcare for the Homeless to provide vaccine to them, so that they could start vaccinating as well back in February and March. And right now they have been doing that. So there have been approximately 3,000, let me get the exact number, almost 3,000 vaccines have been focused on individuals that are experiencing homelessness or also have substance use disorder as well, or live in congregate settings. And that is exclusive, not inclusive of the vaccines that have been administered through our community partners that are focused on that specific population.
Thank you. Committee members, are there any other questions at this time? And seeing none, I want to thank you, Dr. Deraza. I want to thank you, Dr. McDowell, the other members of the health department team who I see today. Again, thank you for your leadership and just ensuring equitable vaccination across the city. We're going to be moving into public testimony at this particular time. And bear with me just a few moments. And the committee staff is now going to call on members of the public who wish to testify on the resolution 21-0003R. Members of the public, you'll have 2 minutes each to provide your testimony. For those who are signed in using a computer, please use the raise hand function to indicate that you wish to testify. We'll make sure to start with you. Next, we're going to go through all of the users who have called into the hearing, and attendees who called in cannot be identified by name. You will be unmuted by the committee staff one by one. You will hear 2 beeps when you're unmuted. If you wish to testify, please state your name at the beginning of your testimony. If a caller does not wish to provide testimony, you simply need to state that you don't want to provide the testimony after the 2 beeps. Understand that there may be callers who are here for other hearings that we have today. You can also just state that you're going to provide testimony for another hearing if that is the case. And Matt, whenever you're ready. Thank you.
Thank you, Madam Chair. It does not look like we have any raised hands this time or callers who are from the public.
Okay, so I want to thank everyone for joining us for this hearing. The work session on Resolution 21-0003R is now in recess. The committee will likely hold an additional work session in the coming months to keep the community informed about vaccination efforts and progress across the city.